Hello, friends. So, now we are gonna start from where we left off, the diseases associated with asbestos lung cancer. So, first of all, we have parenchymal asbestosis. Parenchymal asbestosis diffuse interstitial fibrosis with the restrictive pattern of disease on pulmonary function testing. In this type, we can see a mixed pattern. Also, it causes impaired gas exchange and progressive exertional dyspnea. The radiographic changes is more than 10 years, and latency period is between 20 to 40 years. Now, for the second part, we have asbestos-related pleural abnormalities. There are four types of abnormalities like pleural plaques, benign asbestos, pleural effusions, diffuse pleural thickening, and rounding atelectasis. Mostly these are asymptomatic and they do not show any symptoms, though some can cause dyspnea or cough. In some cases, we can see some sort of symptoms like dyspnea or coughing. The latency period for this type of abnormality is 10 to 30 years, and the shortest latency is for pleural effusion. Now we're going to see lung carcinoma. The risks depend upon level, frequency, and duration of exposure, time elapsed since exposure, age at the time of exposure, smoking history, also individual susceptibility factors. These are still under investigation and we do not include it in the risk factors. And the lung carcinoma latency period is between 20 to 30 years. Now, the other type is malignant pleural mesothelioma. This type of tumor arises from the thin serosal membrane surrounding the lungs, and it is rapidly invasive. It is rare, but incidents are increasing day by day, and it has the longest latency period, around 30 to 40 years. The other type we have malignant peritoneal mesothelioma. It is duffy feeling on abdominal palpation, and the ratio between male and female incidence is 1.5:1, means it is most common in males as well as in females. So it is also rapidly invasive and rapidly fatal, and it is associated with high dose asbestos exposures, such as for the people working in the factories or construction companies, and it is also rare. Now, there are some other types of extrathoracic cancers like colon cancer, possibly cancer of larynx, stomach, kidney, esophagus. Association with the asbestos exposures remain controversial. Regular colon cancer screening for people over age of 50 years. So we do regular screening tests for people who are above 50 years so that we know if they are suffering from extrathoracic cancers. Screening for other extrathoracic cancers are not recommended. Now there are some cardiovascular conditions which we're going to discuss. Pulmonale. It is secondary to chronic lung disease, and it is mainly with severe parenchymal asbestosis. And second of all, we're going to discuss constrictive pericarditis, which is secondary to asbestos-associated diseases, and it is also very rare. The risk factors involved are concentration. First of all, it is nature and extent of exposures, and the second factor, the most severe one, is cigarette smoking. So nature and extent of exposure, it consists of three parts: concentration of asbestos fibers, duration of exposure, and frequency of exposure. So cigarette smoking, we've already discussed before. It is synergistic. So we're gonna see the diagnosis of asbestos-related diseases. First of all, we have medical evaluation of all patients. It should include assessment of clinical presentations, exposure history, medical history, physical examination, chest radiograph, and pulmonary function test. And secondly, we have radiological and laboratory testing, which can include CT, HRCT, BAL, lung biopsy,